For years, doctors have talked about the benefits of the HPV vaccine, but a majority of parents in the U.S. are still not getting their kids vaccinated. Only 38% of American girls and 14% of boys have received it. The vaccine protects against the human papillomavirus, a sexually transmitted disease that can cause cervical cancer in women. Now, a new study suggests the vaccine could also fight head and neck cancer in men and save the country's healthcare system millions of dollars a year. Dr. Devi joins us now. She is an assistant professor at the NYU School of Medicine. Devi, always good to see you.
Nice to see you too.
As I said, this was initially out there to prevent an STD, genital warts, which are caused by the human papillomavirus.
Yeah.
But the reality is, the more we've looked at it, it's not just about preventing cervical cancer. This could prevent a whole series of other cancers.
Yeah, that's the truth. So the thing is, people have been focused, I think, on the fact that it is a sexually transmitted disease. And so I think that's one of the reasons that parents don't actually get their young kids vaccinated. The problem is, if you don't get the kids vaccinated when they're younger, once they already get exposed to the virus when they're a little bit older, then the vaccine is not as effective. The vaccine is a teaching tool to teach the body how to fight the virus. So it can prevent, cervical cancer. There's some evidence that can prevent oral cancer, anal cancer, penile cancer. There's a whole host of cancers you could protect your child from.
And I hate to reduce this to a marketing issue, but is that what the problem has been? That this has been marketed as an STD vaccine as opposed to marketing as what it seems to really be, which is a cancer vaccine?
I think that's part of it. I mean, in Australia, they actually have a much better vaccination rate of about 80%, and I think that's because they really are focusing on the fact that it can protect your child from cancer. Now, it's not 100% effective. It's not that the vaccine totally prevents the cancer, but it's somewhere between 70 to 90% effective, according to some of the estimates.
Now, how sure are we that this could prevent mouth and throat and other cancers?
Well, we're not absolutely sure. So the way that these studies are normally done is that you take two groups of people who've been vaccinated and people who haven't been vaccinated, and then you follow them over time and you try to see who develops the cancer and if there's a difference between the two groups. Now, the problem is with oral cancer, a lot of those are kind of rare and you'd have to follow them for a long time. Maybe it takes 40 to 50 years for a person to develop it. So it's hard to actually get those studies done. But the thing is, we know that a lot of those cancers are actually caused or related to this virus. So the estimate is now 70% of those cancers may be related to HPV. So if you can reduce that amount, if you can actually prevent the virus from taking hold and creating those cancers, that could be a huge benefit.
Now, when this vaccine first came out, there were some alarming stories. It has been proven to be very safe?
Yeah, it's been proven to be safe. I mean, sometimes, there are people who have allergies just to different kinds of vaccines just from the process of making a vaccine. So those people shouldn't get it. Sometimes you can get a fever, you can get some pain. These are minor side effects. But in terms of the things that people were concerned about, let's say autism or things like that, there's absolutely no evidence to support that, and actually it's been refuted.
You talked about the age at which people should get this. I know they say not to get it after 26. Why not?
Well, it's not that people absolutely can't get it after 26. The thing is that most people have been exposed to HPV by that time. So the thing is, if they've already had the actual virus, then the vaccine's not as effective.
And again, it's important for boys to get this as well because, in fact, more men suffer from throat and mouth, head and neck cancers.
You brought up a great point. I mean, that's the truth. So more boys or more men actually suffer from that. And then also, if you think about it, if a boy gets vaccinated, they can also protect women that way too, because where do women get this HPV virus from? They get it from boys. So you actually protect yourself and you protect the people around you, your future wife, different people.
And I know it's believed that in the long run, we might see more head and neck cancers from HPV than cervical cancers.
Exactly.
So it's very important for people to pay attention to this.
Exactly.
Devi, always good to have you with us.
Nice to see you too.